Hey friends, Dr. Charlie Ware here, your leading expert in chronic pain management and also other chronic diseases. I want to talk to you about stress. As I said, are you in pain because you're stressed, or are you stressed because you're in pain? I've done different talks about stress and stress management and the reason why stress is bad for you, but I want to go just a little bit deeper because I feel like enough individuals aren't really understanding why stress is so bad for you on a chronic level. I'm not going to talk about the daily stressors and you're having a bad day so you're stressed out. I'm not talking about different things like that. Stress is actually a good thing. Even the stress hormone cortisol that everyone's trying to beat down and get out your body so much is actually, in the beginning, is actually a good thing. It's actually a good thing because of the fact that stress is part of the growth process of muscles. Stress is actually a good thing because when your body is stressed out in an immunity situation, your body is now building more antibodies, so you're able to now fight other diseases and viruses that come inside your body. Stress is actually a good thing to keep you mentally acute or mentally aware, muscle memory, things like that. So stress is not a bad thing on its face, but what I'm talking about is when it goes to the chronic level, where it's something that your body is not getting rid of really enough, and you're producing too many antibodies or too many bad chemicals that's now allowing your body to go into different pain loops or pain cycles. Now, the research shows that about 99% of all stress that we deal with we're able to control. Basically, if you're having a bad day, you're able to control if you're having a bad day or not, for the most part. And in most cases, even if it's a stressful situation, you're able to control it to a certain degree. And only 1% of that is something that we cannot control. The other stat I want to throw out there to you is the fact that 90%, now I want you to understand, 90% of all doctor's visits is because of a stress-related issue. So again, most individuals are stressed out and don't have a clue on how to deal with this. And that's why when I discuss things about stress, first thing most people will say is the fact that they're not stressed out. And it's a very, very common thing. So, I'm not stressed out, I'm fine. Or some people are over-exaggerate with it and say that I'm always so stressed out, they don't have a clue on what to do, and they really aren't stressed out. Stress is really a perceived thing. Now, when I'm talking about, chronic situations is when I'm talking about chronic pain individuals or chronic disease individuals that they have a pain on a daily basis, or they have a perception of pain on a daily basis and they don't know what to do about it. So let me go and run down through a few situations what actually happens. Excuse me, move my adult out of the way because it's bothering me right now. A few situations where it is very, very true. Now, I'm talking to the community right now that it was created for chronic situations, whether it's sickle cell disease, diabetes, hypertension, anxiety, stress, whatever it is. This is the community I'm talking to right now. And so a lot of you guys understand the fact that most individuals that have sickle cell disease have a rate of anxiety because of the fact that they don't want to experience, the pain on a daily basis, or they wake up with a perceived pain situation. And I say perceived because a lot of times we are over medicated and we're not able to understand what really is pain and what really is, back it up, what really is a sickle cell pain and what really is a normal pain in our body. So it's a level of anxiety that constantly goes on that we have to, again, teach ourselves on what's true and what's not really true. So when someone's under a constant amount of stress, that anxiety sort of goes up. Or if they're under a large amount of anxiety, that stress, again, goes up. So they actually play off each other. So let me go ahead and break some things down to you. When I'm talking about the thrombus, like a pro-thrombus type reaction. When I say thrombus, basically means that the clotting factors are increased when you're in a high stress or a chronic stress situation. And what that basically means for actually the clotting factor number 7 is what's actually increased. And that's important for a sickle cell patient because we don't want the blood to clot too fast, do we? More clotting basically means that there's a more chance of you actually going to a sickle cell crisis. And now if I'm already telling you that because you're in a chronic pain situation or chronic stress situation, that your stress levels are now creating negative effects on your body that's now causing your body to actually increase the clotting factors, what do you think is going to happen to your body? It's now going to start breaking itself down, and you'll start to have more of a pain situation because now there's more inflammation as well. And that's the second one, is the pro-inflammatory responses in the body are now shot up to be about anywhere from 7.5 up to 12 times more in your body than a normal individual. So now if you're more apt to have more inflammation inside your body as well. Again, that's again, you already have more clotting going on, so the blood's getting thicker. Now you have more inflammation that's going on, and the inflammation is not just, as if, oh, you have a swollen muscle. No, it's in the actual artery and vessels themselves. It's in the blood vessels that's all this inflammation is actually being created. So those are two of the main things that really goes on when you have this chronic stress situation that goes on almost on a daily basis with a lot of individuals. So that daily pain level that you're experiencing may not be because of the fact that you are actually in a pain situation. You are actually in a stress situation, and those two are a perfect petri dish to make sure that you go into a crisis on a daily basis. And those, I sort of keep the term micro or mini crisis on a daily basis, that you're not able to control. And now you're not able to control yourself, so you're taking pain medication in order to mask that. And again, you're not doing anything to really get rid of the root cause. And that's really, really big. The other thing is the fact that now that you have the blood vessel inflamed, you have the blood itself that's already clotting a lot faster. Now the fat that's inside your body is now starting to turn on. It's starting to oxidize. It's starting to not do what it's supposed to do. It's starting to clump together inside of the blood vessel a lot faster as well. These are different factors that happen when you are in a kind of chronic stress situation. Another one is the fact that your heart rate goes up, your blood pressure goes up, and then basically your heart rate variability, basically meaning able to control how fast your heart is beating, is now out the window as well. And this is, again, I go back to it, it's a chronic pain or a chronic stress type situation. And the last one that actually happens that's very, very important. A lot of individuals always ask me about nitric oxide, the importance of that as an anti-inflammatory thing. One of the things that the Indira or the L-glutamine that it does is it helps your body to be less inflamed. But if you're in a chronic pain state, the L-glutamine is not going to actually help a whole lot because of the fact that what it happens is the production of the nitric oxide is actually reduced. And then the enzyme that actually helps your body transform, other chemicals into nitric oxide is actually almost wiped out almost completely as well. And then the last thing is the flow of mediated blood flow in your body, which basically means how well your blood flows throughout your body. The viscosity and things of that sort is actually reduced as well. So if you put all these factors together and think about it from a sickle cell standpoint, almost everything I just spoke to you was almost every reason why a sickle cell patient would go into pain, actually, correct? Sorry, I don't know why my camera, thank you, it was going crazy. But anyway, every reason why I just spoke about was just telling you the reason why a sickle cell patient will go into a crisis, okay? Ms. Lewis, how are we doing today? Pain is not only in the muscles, it's also in the artery. From a sickle cell patient, you gotta understand that the pain starts in the artery itself. The issue is actually in the arteries. It's in the veins and also the arteries themselves. And then it actually causes the occlusion inside of the muscle or the joint itself. So it starts at the blood level. Okay, so that's the real issue here. Is that most individuals don't understand that just by simply massaging, sometimes it may work, but again, you got to get that blood flowing as fast as possible and as thin as possible. Now, I'm not saying take blood thinners because they tried that for years and they found that does not work. It actually causes more issues by thinning the blood out. What happens is this. Like I said in the actual title itself, are you stressed out because you're in pain, or are you in pain because you're stressed out? It's both. We already know you have a chronic situation. But in the same token, if you know you have a chronic situation, we also have to make sure that your body is getting everything it needs. So, yes, this is a shameless plug, but I'm going to tell you the reason why the creation of the Healing Blends products was so important to me in the way I formulated them. I understand, that the main issue, yes, is pain. So, okay, let's go ahead and do something about the pain. The second token was I knew that we had to increase vasodilation in nitric oxide production inside the body. But the main thing that most individuals skip out on is the adaptogens that the body needs to actually help you deal with the stress in your life. Whether it be environmental stress, whether it be personal stress, whether it be chemical stress that, again, that you can't control, or again, perceived stress, there's a certain amount of stress that's inside your body. So long story short, that's the reason why, let's say, Even Flow was created on all of those levels right there. What's because of the fact that we dealt with the vasodilation, we dealt with the pain level, we dealt with the movement of the blood itself. But more importantly, we also dealt with actually reducing the rate of stress and stress oxidation, inside the body itself. Basically means that what happens is we all know that antioxidants, everyone's big on those. Yes, it's great. But again, when those cells start to break apart, especially in sickle cell rating, how are they being washed away from the body? How are they being taken away and actually not adding extra stress on the actual cells themselves? One reason why the retic rate in sickle cell patients is so high because of the fact that you're producing those red blood cells so rapidly out of the bone marrow. But in the same token, one reason why sometimes it doesn't go down is because of the fact that the body does not know how to turn that off, even when the person is healthy. I've seen some people's retic rate up to like in the 30s and 40s, which is like insanely high. That's like leukemia type thing. But again, it's just the fact that they don't know how to turn off that because of the fact that their body's in a constant state of stress and inflammation and everything that goes along with that. Sometimes it's just really that simple of understanding the fact that when you see patients on a daily basis, again, I'll say it again, I'm one of the few doctors that I know of, especially doing it from a naturalistic standpoint, that sees sickle cell patients almost every day, which is a sad thing, but also a good thing for the sickle cell community. So if I'm seeing these patients on a daily basis, I'm understanding their physiology a bit more because I'm able to treat and I'm seeing the results that we're getting. And I see most of them come in, and especially the parents, the caregivers, are under a certain amount of stress themselves. And that, kids actually absorb that. If you're stressed out, the kid's going to absorb that and they can sort of see like, this is how it should be. I should be in a panic state all the time. And I always tell the patients, calm down, relax. The more you're relaxed, the more your body's gonna be able to relax and breathe and actually allow the information to absorb. And you're not reacting to something. You're acting on something in a very logical standpoint. And I gave you some information before where, even the research shows that the more stressed you are, the more white matter you produce inside your brain. White matter is not where the electric impulses sort of go. You want white. You produce more gray matter. You want more white matter. White matter is where the electric impulses sort of go. That's the myelination. That's where things are happening. Gray matter is basically where things they're not dead, but it's more so it's not as active. It's not as excitatory. Type thing. So there's a lot of research that shows that these chronic stress situations have huge physiological and also health consequences. So, something like peaceful calm and less stress were created for caregivers and also for sickle cell patients. I always have people always ask me, what can these products do? And the main thing was, especially with the peaceful calm, I told you before, that the base of peaceful calm was actually as part of a study that was for individuals that were trying to get off like methadone and heroin, and showed that, given the base of this formula, these individuals were able to sleep better and had less anxiety as well without any other medications. And they were able to actually get off, these bad drugs at a faster rate as well. So if it works on individuals like that, I know it will work on individuals with sickle cell disease or any other case. And I've seen it work inside of the office as well. Less stress is more so for individuals that have more of the physical aspects of the headaches and the tight muscles and the TMJ or the clenched jaws, things like that. It helps relax that. It helps your body to naturally relax, and things there. So it was everything that has been created by Healing Blades Global has been very intentional. Nothing has been created just because it was all created out of a need. And the reason why I'm even bringing that up because of the fact that I know I've spoken about stress many different times in many different ways. But now I want to show you from a physiological standpoint what's really going on. And again, some of the information I'm telling you guys is just from my anatomy physiology that I took many moons ago in uni and also in medical school. And I still I'm doing my genetics course now. I'm getting my degree in genetics as well. So, it's just stuff that sort of crops up and it helps me to remember, like, wow, yes, these are the root causes of a lot of these situations. I had a patient in here yesterday. He's 17 years old, and he's working on this brilliant thing for sickle cell. He has sickle cell disease. He was battling pneumonia. He and I helped him get over pneumonia in a natural sense. He didn't take any medication. He was not in the hospital. He was actually out with his friends at the beach, in the middle of this whole situation, which was kind of crazy. But anyway, again, why is it that individuals like himself, sickle cell SS, as they say, full-blown sickle cell, and he's able to be at a beach. He has pneumonia, but no one sees that he's sick. He knows he's not feeling great, but he's not in any pain. He's not in the hospital. It's because of the fact that I've been with this young man for the last 7 years, and his parents are very, very proactive in doing a lot of things that allow his body to rest and relax and to heal itself. And the main thing is he's not that stressed. Not saying that he's not a stressed individual, because I mean the kids, he's one in the top school. He's in one of the top schools, definitely in the state of Florida. He's actually doing 3 research projects right now. So he's an amazing, intelligent young man. He actually has a scholarship, I think, to Harvard or the MIT. So he's amazingly intelligent. So he is stressed, but he knows how to mediate his stress where he can still function on a daily basis. Miss Love always. I'm sorry. I'm just now enjoying. Honestly, and forgive me for what I say right now. I don't care if you have SS. I don't have you at SC, beta thalassemia. I don't care what you have. I know individuals with the weakest form, quote unquote, or genetic coding for sickle cell disease die. I know individuals just with one trait die. I've seen individuals like this young man with quote unquote full blown the worst form of sickle cell disease, and he's flourishing. He plays lacrosse, he plays soccer, and he's awesome. So it's really about how you're going to approach these situations and what you're going to do on a daily basis to enhance your child's life or your life if you're an individual. So you gotta be, you can't just say, okay, well, you have the worst form. This is your sentence. Here at Healing Lens Global, here at my office, what I tell all my patients, I don't care what you have, is I want you to live life without limits. LLWL, hashtag LLWL. We've been doing that forever, and that's our new moniker. We're living life without limits. I don't care what you have. I don't care, who you are. What you're going to do is you follow what we're asking you to do, and you'll see the results. That's it. Okay? What do you suggest for inflammation and increased nerve signals? That's a very broad question. As far as why that person has a decrease nerve impulse or has inflammation. I'm gonna always say start with diet first and foremost. I'm not gonna say go out and get a bunch of supplements and do all this other stuff. Start with diet. Make sure your hydration is proper. Make sure you have the proper trace minerals and nutrients in your system first and foremost before you take any sort of supplement. Because I don't care what you do. I don't care what supplements you take. If you're not eating properly, you're gonna only get a small percentage of the benefit out of that. You gotta change your diet. You gotta change your life in order for you and everyone around you to actually live a better life. That's what I've always preached, and I will continue to preach that over and over again because I see it. Part of a lot of what I do is orthomolecular nutrition and also epigenetics. These are big words, but whatever. I'm looking at things from a very rudimentary and basic standpoint: how your genes are going to function, and what sort of diet can I put you on, and mix those things around, and then with some supplementation to allow your body to function the best. That's all I'm doing. It sounds very simple, but it really isn't. But once you buy into my plan, you always, get better. And that's one reason why this young man, and I say about 80% of the patients that see me face to face, they get better because of the fact that they buy into the plan and they actually get better. The other 20%, they're either stubborn or there's a communication lag. Maybe I'm not saying it the right way. Maybe I'm not, appealing to their psyche. Or the main thing, to be honest with you, is fear. Most times when I change someone's diet, I change someone's perspective of their health and healing, it's out of fear. Well, I don't know. I'm like, what else do you have to lose except for not being in pain? That's it, So back to the whole chronic thing, and thank you for the question. Honestly, it was beautiful questions because most individuals are afraid to ask those same questions right there. I only do things, and I say this over and over again in all my videos. I only do videos when someone asks me a question or I see situations starting to crop up. It's towards the end of summer right now. I see a lot of individuals again back inside the hospital. I hear about them. People are calling and asking me what can they do, and I'm like, the person overstressed their body. I know right now outside, I went outside and I actually got a slight headache. Why did I get a slight headache? One, well, the humidity outside is probably maybe at 89 to 90%. It's kind of crazy, and it's around 95 degrees. So it's crazy outside right now. Why would you allow a little child to be outside playing in a pool or wherever, or even, you know, if you're working outside or whatever, and not hydrate or just cover yourself and be protected? You know, sometimes we want to push things to the limits a little too far because we want them to be normal, but again, normal in their own way. You know, you can flourish in your own way as long as you're allowing your body to rest and relax. And again, a huge part of it is the fact that that's an environmental stress that you can control to a certain point, but you got to be smart about it. You got to understand that if you go outside and you haven't hydrated, you know, already with the proper amount of trace minerals and water, what's going to happen? You're going to get dehydrated. Some people get dizzy and pass out. A sickle cell person, their blood gets very, very thick. They start feeling pain. They aren't able to have as much stamina, and they have to go to the hospital. You got to be very smart about these things, okay? And of course, you know, take your supplements and things that like that we always suggest too, okay? Just in closing, the main thing, like I said, you know, this chronic stress situation, the first three things: the clotting factor that's actually increased, the inflammation that's actually increased, the fact that the cell, I'm sorry, not the cell, but the veins and arteries that carry the blood is actually, you know, getting inflamed from a chronic situation. So if you already know that you're in a chronic stress situation and you're a sickle cell, or your child has sickle cell, or your loved one has sickle cell, and you know they're always stressed out or have anxiety, let's start taking those steps. Let's start taking those steps to basically reduce the stress. I'm not saying baby them. I'm not saying any of that. I'm like, there's proper supplementation called adaptogens that you can give the individuals. There are adrenal supplements. There, again, is the peaceful calm, it's the less stress. You can give them holy basil as a tea, and that's actually, it tastes pretty good. It actually tastes sort of like cinnamon. You can give them, oh my gosh, I went blank. You can give them like licorice root. You can give them dandelion root. There's many different things you can give them. Another thing you want to do is make sure you actually give them a balanced diet. Lots of leafy greens. You can give them, you know, green smoothies that's not too sweet. You can give them small pieces of protein with a lot of veggies around there. If you know they have a allergic reaction to something like dairy, again, 98.9% of individuals of African descent have a allergy to dairy. Any sort of dairy, cheese, butter, whatever it may be, yogurt, whatever it is, they have an allergy to it. So if you already know you're giving your child a lot of yogurt and a lot of these cheese, whatever, stop doing that. Give them goat. Goat is basically hyperallergenic, and your body's actually able to easily digest all that stuff, and you don't have an allergy to it as well. So it's a good substitute. It may be a little more expensive sometimes, but it depends on where you get it from. But again, it's different things like that. And then hydration. Make sure you're having the fruits and veggies on a daily basis, but also hydration. And when I say hydrate, make sure it's good water with the electrolytes inside of it as well. So those three things are going to allow the body to not be as stressed. And then you work on the mental stress, you know, have them do things that they enjoy, get their mind off the pain. That way you tell them, hey, look, these things that we're doing is designed to make sure your body won't react to the stress or to the pain as much. So therefore you won't have that cycle of being in pain over and over and over again. All right, guys. So those are just a few tips I have for you guys. I know it's a lot of information. I'm talking, you know, about, you know, clotting factors and all these other things, but it's very, very important you guys understand that it's not just about, you know, my muscle, my joint hurts. It starts very deep. It starts very, very much so in your brain a lot of times, and then it actually happens to a physical pain, things there. So, and again, if you guys have any questions, always feel free to reach out to me, you know, here in this chat box, or even on different channels on Facebook as well. So if you guys have any questions, please feel free to reach out. Love you guys. Have a phenomenal evening. I'm going home and eat. Talk to you soon. Bye.